All right. Thank you for tuning in. This is an introduction to coping techniques for labor and childbirth. And we hope in this short presentation, we'll introduce a few comfort measures, hypnobirthing, and some other tools that doulas use with parents who plan to have a baby. We hope that you'll take away some inspiration to look further into certain techniques and learn some new things.
Absolutely. Thanks for being here.
Do you want to introduce yourself, Andrea?
Yes. Sorry, I'm just muting my phone really fast. My apologies. Yes, I'm Andrea Dorzub, and I am the founder of Columbia Gorge Birth Services. And Angie and I are both doulas. I'm also a hypnobirthing practitioner, so I'm excited to share with you some introductory principles from that class today too.
I'm excited for that. I am a fertility, birth, and postpartum doula in the Gorge, even Portland metro area. I love our local community here, and I want all the families to feel really safe and supported through all of their reproductive journeys. I also teach Red Cross first aid and CPR and wilderness first aid. I'm really outdoorsy, so I like helping families stay active with their outdoor passion. So if you need any outdoor or just basic first aid training, I can help with that too. I also occasionally blog on my website, so you can let me know if you have any requests for blog topics, and I'd be happy to join in. But yeah, that's us. I guess we can we'll move right along into physical comfort measures. I'm going right into the juicy stuff. So I think first we can start with a little bit of science. Oh, but that's us. You can find our business names right there. So it's important to know when you're thinking about childbirth that you can have pain without suffering, and you can have suffering without pain. So pain is it's an unpleasant physical sensation, but it's common. So even if you're on a hard hike out here in the gorge, you might feel pain going up some of those steep uphills, but that probably isn't suffering. Even if you break an arm, you might be in lots of pain, but you're not truly suffering, because suffering requires psychological distress. So remorse, panic, helplessness, anguish, a feeling of complete loss of control, or really intense fear. So most people have a goal during labor and birth to avoid suffering. A long and intense labor and birth doesn't require suffering, even if there's pain involved at parts. Of course, you want to avoid unnecessary sources of pain in labor. So minding your basic needs can help with that. Making sure you're getting sleep when appropriate. So early labor, try and rest. Avoid hunger and thirst, since that'll exacerbate any feelings you're having. Remember to urinate and get out of any labor positions that make you feel uncomfortable. For example, a lot of people don't like lying on their back during labor, and you don't have to. And we'll cover that a little bit today too. So yeah, we'll talk about this later. Andrea will touch on how excess tension in your body can lead to pain, whether it's mental or physical tension. Sometimes even people might have performance anxiety during labor, or wasting energy in other ways, like, oh, I can feel that labor starting, so I'm gonna do all the things, when really they could be resting and saving their energy for later on. Actually, I'll stay here. So whenever your body perceives some kind of stress or danger, it wants to enter the fight, flight, or freeze system or mode. So that's your sympathetic nervous system, which Andrea will go into a little bit later as well. But being in the sympathetic nervous system, it increases your adrenaline and muscle contractions through catecholamines. And you want to avoid this during labor, since those hormones can slow down your labor and increase tension. And like I said, tension increases pain. Instead, doulas can help you do this, to tap into your parasympathetic nervous system, because this is where your body releases oxytocin, the feel-good hormone, and endorphins. Oxytocin is great for bonding. It's what can make you feel euphoric when your baby arrives. And endorphins are natural painkillers. They're relaxants. They're 200 times more effective as a painkiller than morphine. And it's totally free and accessible in your body. So let's talk about how you can manage pain and discomfort. We want to reduce as much pain as possible in childbirth and make you feel as comfortable and confident as possible. So depending on your unique self and any techniques that you use, you might actually really reduce pain, or you might just get this nice feeling of confidence and mastery while you're riding the waves of childbirth. So hopefully you'll get a little both of those and by tapping into the parasympathetic nervous system. So one way to increase your comfort is focusing on positions and movement during labor. Movement is great to help progress labor. It can help your body descend down the pelvis and just keep you feeling more comfortable. Your instincts will often tell you how to move and position yourself to minimize any discomfort, but sometimes you need to get creative. So you can use props like a birth ball, pile of pillows, a chair, sitting on the toilet, something to hang on to, like a bar from the wall. There are a lot of objects that you can use to help you find a more comfortable position. And even without props, you might just find yourself switching between like sitting, standing, leaning, swaying, squatting, rocking, slow dancing. And your partner can help with this by suggesting changes or staying quiet if you just want some quiet, helping you move between positions, being your dance partner for the slow dancing position, and just finding other tools to keep you comfortable as you're moving around. Breathing rhythms you can practice before labor. So right now, if you're pregnant, you can start practicing your breathing tools now so that you'll have the muscle memory and confidence when you need it. So during active labor, a lot of people will use a big, slow sigh or moan on the exhale while focusing on releasing tension. It's the deepest tension release will come from low visceral sound, sort of like a cow mooing noise. And if you pair that breathing with some kind of body rhythm, like rocking, tapping, counting, or swaying, it'll help you adopt a rhythm. And your body really likes rhythms during childbirth because it's comforting and it's almost distracting in a way. If you find that you're adopting a rhythm, then you're probably coping pretty well with labor. But then as people approach pushing stage of labor, a lot of people will naturally switch into a faster, shallower pant, like a breath every 2 or 3 seconds. So you'll find that your body might tell you exactly what you need to do, but researching it while you're pregnant is helpful. Your partner can help you stay in this rhythm by swaying with you, lightly touching a part of your body for an entire contraction, just to feel that grounding, stopping when you say stop. If you lose your rhythm, your birth partner can help you restart the rhythm by maintaining eye contact and starting it for you, coaching you through the breathing. So that's breathing. Heat and cold, they are both really great tools to use during labor, and you might find yourself using both of them. Heat is really good to apply where the body's feeling that tension, so maybe your lower abdomen, your lower back, or the shoulders. It can even be nice during to use on the perineum while you're pushing, like on a warm, wet washcloth. You could use a hot water bottle, a warm gel pack, or a hot, moist towel to apply heat to your body. You can have your partner do it. And cold can be really soothing. You can use a chilled washcloth on the forehead or apply it directly to painful spots like the lower back. So you might use an ice pack, a cold soda can. If you're in a pinch in the hospital, you can even use like a hospital glove filled up with ice chips, because we use ice chips a lot during labor. Also, applying a cold compress to the perineum after pushing can help avoid some swelling and soreness there. You just need to be vocal with your partner or your healthcare provider or doula about what you'd like to try with heat and cold, or what you don't like anymore. And then we'll just take the heat and cold away. Hydrotherapy is super cool. Water hitting your body, it's stimulating and warm, so it can soothe you while distracting you from any tension or pain. So handheld shower heads are really amazing because you can put the water right where you want it. If you have access to a shower or tub with a handheld shower head, or not, maybe it's just a normal faucet, but you can put a stool in there so that you can get the water hitting a certain part of your back or your front. That can be really soothing. Baths are also great. The buoyancy in a bath can help relieve pressure. It helps you relax. You feel more mobile because you have the water taking away gravity, essentially. Not all places will let you labor in a tub. Not all places will let you give birth in a tub, but some will. At home, you can rent birth tubs if that's something you're interested in. Then you can give a quick Google birth tubs in your region, and you might find some rentals. And we have touch and massage. So touch and massage are very specific to the person giving birth because we all like and dislike certain methods of touching. But this is a tool where the birth partner and your doula can really shine. So it could be really small things like holding your hand, brushing your hair, having just a comforting hand on the shoulder. Some kind of caring, comforting touch can really go a long way. It could be some kind of more intentional massage, like on the scalp feels really nice. Your hands, your feet, back and shoulders. You can play around, see if you like strokes to be light or firm, whether you like kneading, direct pressure, just hands, or using certain massage tools. It's really person specific. So you'll want to be vocal in the moment about what you're liking or not liking, as well as kind of having an idea before. So you can try out some different techniques now while you're pregnant and see what you do or definitely don't like. If you know that you're going to want some kind of massage during labor, you'll probably want to bring some lotion or oil with you. So I will describe a little at-home experiment that you can try later on, or you can press pause, I suppose, and do it now. It is more fun if you can make your birth partner do this with you. But essentially, there's something called the gate control theory of pain. And it says that your body and your brain can only process so many signals at once. So according to this theory, if you focus on pain, you will feel pain. But if you're able to focus on something more pleasant as a distraction, you'll feel less pain overall. I think a non-pregnancy example of this might be like if you notice you have a bit of a headache, but then you go and watch a really good TV show or movie, you might forget that you have the headache because you're getting all the other input and stimulation that your body kind of forgets about it or is distracted from it. So in this ICE experiment, you'll practice 60-second labor contractions by holding a bag of ice. So each time that you experience a contraction or a wave, you can try a different coping technique. So you'll hold a small bag of ice. You can get like a sandwich size baggie or a handful of ice in a produce bag. And I suggest alternating hands between each practice. So you'll set a timer for 60 seconds. You'll put the baggie of ice in one hand. And for the first round, you're just finding your baseline discomfort. So don't use any technique, just sit there and look at the ice in your hand that you're holding and see how that goes. Then for the next round, you'll reset your timer for 60 seconds, hold the ice in the other hand. And this time for the full 60 seconds, I want you to practice relaxation in a slow, intentional breath where you're focusing on releasing tension with each deep exhale. And you can count breaths here as well. Then after the 60 seconds is up, you'll be able to compare how that coping mechanism helped you hold the ice. Maybe it wasn't as uncomfortable. Maybe it seemed to go by faster. So then we'll try another method. The third one, I want you to hold the ice back in the other hand and determine a focal point, either somewhere real, like in the room in front of you. Maybe you have a nice, beautiful floral painting, or you can have an imaginary focal point. So a visualization, you can imagine a palm tree. Close your eyes and think about the beach. So do that for 60 seconds, see how that one went. And then the final experiment would be holding the bag of ice for 60 seconds while your partner gives you some kind of touch that you know that you like. So it might be one of the types of massage I mentioned, combing your hair, anything that we discussed earlier or something that you know you enjoy. So after you've done all 4 rounds of the ice holding, you'll want to reflect on which practices felt the least and the most comfortable to you. Hopefully everything felt better than the baseline round, the first one where you had no coping technique. But you might find that you found one to be way more enjoyable or easier for you than the rest. So if you loved the visualization, that might give you an idea to look for some really great visualizations to use during labor. And then you can practice them during pregnancy so that your body and your mind remember to fall back into that calming relaxation during labor. And that is just your new labor visualization. If touch was your favorite, you might want to write down your preferred touch techniques into your birth plan or some kind of notes for your partner so that your birth partner can reference them during labor. Maybe they forget things, and everything is so magical during childbirth that having things written down is really helpful to remember how they can best support you. So I think I'll pass it on to Andrea now for some hypnobirthing and more mental coping techniques for labor.
All right, thank you, Angie, for that great information. We are, going to talk about hypnobirthing, and a lot of what you see here with hypnobirthing is like the iceberg there. It's just at the tip of the iceberg, but there's a lot that goes underneath. It's sort of like a zoom lens on a camera. So there's a theory that the body is like a robot. Only the mind determines what and when the body feels. We see with our minds, we think with our minds, and we feel with our minds. So our bodies can't become ill, for example, unless our minds tell them to. That's what the theories are behind hypnobirthing. There are 4 powerful laws of the mind and of change, and these have a direct effect on changing the view of birthing. They are the law of harmonious attraction, the law of motivation, the law of repetition and substitution, and the law of psychosocial association. This one is the most important, and we're going to talk more about that in a minute. But the law of repetition and substitution says that the mind can only hold one thought at a time. Thought precedes reality. Therefore, new programming in the subconscious is always more powerful and always wins out over past programming when the two are in conflict. Our words are powerful, and this is where affirmations are helpful. And the law of psychophysical association says that for every thought, there is a corresponding physical and chemical response and change within the body. The body follows the mind. Think about what happens when you're driving down the road and maybe you're going a little too fast, or even if you think you're going too fast, when you see a cop, what automatically happens? Now, I know for me, it's a little bit of a panic. Heart starts racing. Maybe I touch that pedal and I check my speed, and I'm still nervous if a cop's following me, even though I've done nothing wrong. That is an example of psychophysical association. Other ones we might think of are our bodies jerking when we're startled, or blushing when we're nervous. Now, I'm going to lead you through a couple of exercises now to show you how psychophysical exercises work. Go ahead to the next slide.
Which slide is it?
Oh, sorry. Yeah, we got out of order. We'll do this first. So, okay. So I'd like you to get comfortable and slowly inhale through the nose to the count of 4 in 2, 3, 4. Slowly exhale through the nose to the count of 8. Out, 2, 3, 4, 5, 6, 7, 8. Keeping your mouth closed and allowing your breath to drift down to the back of your throat, into the chest, stomach, and down through the entire body. Feel your shoulders sink into the frame of your body. Allow your eyelids to gently close. Let's do breathe again. In, 2, 3, 4. Out, 2, 3, 4, 5, 6, 7, 8. You'll breathe your body down into relaxation, allowing your shoulders, elbows, and chest to droop into your torso more and more with each exhalation. Relax and let go. So if you're doing this exercise correctly, put your left hand on your stomach and your right hand on the lower part of your chest, just below your breasts. As you do this, you should feel your left hand rising and moving outward, as though your stomach were inflating like a balloon. As you exhale, your right hand should sink into the cavity created by your drooping shoulders and chest. Breathe in relaxation now. Breathe into the count of 4. And breathe down to the count of 8. In, 2, 3, 4. Out, 2, 3, 4, 5, 6, 7, 8. In, 2, 3, 4. Out, 2, 3, 4, 5, 6, 7, 8. Letting your breath flow all the way down through your body as your shoulders begin to droop into the frame of your body. One more in, 2, 3, 4, out, 2, 3, 4, 5, 6, 7, 8. Now, at your own breathing pace, allow your breath to just drift down through your chest, into your stomach, and down through your body, as though it were going to flow all the way down into your toes. Releasing and relaxing, feeling your shoulders, your chest, your elbows becoming limp and relaxed. Release and relax. And now imagine in your mind's eye and your imagination, take yourself to a kitchen. This is a kitchen that you are very fond of from your near or distant past, a place that holds good feelings for you. Could be your grandmother's, your mother's, a trusted friend, one that you would like to go back to at any time. Your subconscious can work quickly, so choose your kitchen now. Look around you. See all the familiar things in this kitchen. Feel the warmth of the room. Breathe in the aroma of your favorite food as it cooks. See the steam, the condensation forming on the windows. Imagine now that you are standing at the counter in this wonderful kitchen. In front of you is a cutting board, and on the cutting board is a beautiful, bright, yellow, round, plump lemon. You can feel and see every one of the pores of this lemon. So smooth. Run your fingers over the lemon. It's almost wax-like. Study all the features of the lemon. The skin is so smooth, entirely free of any spots or shriveling. Beside the board is a large cutting knife. Give yourself permission to pick up the knife. And now, in your mind's eye, see yourself cutting the lemon in half. Watch as the juice runs down and makes small puddles of lemon juice on the board. Now take 1/2 of the lemon and bring it to your nose. Smell the lemon. Now take the lemon and sink your teeth into it. Be aware of the juices. Feel them run through your mouth. Slowly move your tongue around the inside of your mouth. Feel what is happening within your mouth. Very good. Be aware of the changes taking place. Now, slowly come back to the room, and when you're ready, open your eyes. So
I don't know if you saw, but I puckered.
I did. I always like to watch that part because it's very interesting. You can just see people's reaction. So whose kitchen were you in?
I was in my my mom's kitchen in Massachusetts.
Okay, cool. And which way did you cut the lemon?
It's like, you know how lemons have like the weird little bumps? So like the bumps
Mm-hmm.
were like at 12 and 6 and I cut straight. I don't know if that's the right way to cut a lemon, but that's the way.
You know what? Everybody cuts a lemon differently. So what happened when you sank your teeth into the lemon?
It was almost like in my body here, it kind of felt like, I don't know if dry is the right word, but a little bit like sort of like sour and like as if I were biting into a lemon.
Yeah. So what happened when you rolled your tongue around your mouth? Like, what did you feel?
Kind of like I was trying, like when I have something sour and I try and like, get it out. That's what.
Yeah. All right. Yes. So how come you had no lemon? It was made up. The inner conscious mind believed there was a lemon and created the conditions in your mouth. Interesting, huh? So here we see a thought and belief creating a physiological and chemical reaction within the body, just as it does during birthing. Calm thoughts, calm birthing. Fearful thoughts, stressful birthing. It's all about chemistry. We also see that you are able to shut out the distractions of the room and bring yourself to another spot in your imagination. That is hypnosis. There was no long hypnosis lead, no long gradual deepening, and yet you were able to experience a different place and a different sensation. Imagine how easy it will be for you to do this with practice. In very little time and with no effort on your part, you will be able to do this more rapidly and go more deeply into that place where endorphins are readily created, just as you were able to create saliva to neutralize the juice of that lemon. Now let's do one more. Let's show how well you can use your imagination. So I'll let you stay seated during this one. Sometimes they say to stand, but just sit so you're comfortable. And let your arms, are you in a chair where your arms can hang loosely at your sides? Okay. So I'd like you to raise both of your arms to shoulder height in front of you and allow both hands to hang limply downward from your wrists. So in front of you like this. Yeah. Okay. And now turn your left palm upward and gently close your eyes. Please follow the suggestions that I'm going to give you and let your mind act as if what I am saying is happening. Now, please visualize and act as if I'm tying a huge bunch of helium-filled balloons to your right wrist, and the balloons are tugging your wrist upward, pulling and jerking. Your arm is rising. Now imagine that I'm putting a large, heavy pail of wet sand in your left hand. Curl your fingers around the handle on the pail. The pail is so heavy. Your left arm immediately begins to pull downward. You can feel the pull in your muscles. Your right hand is continuing to rise as the helium balloons keep tugging at your right wrist. Arm going up, up, up. Left arm going down, 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 pulling. Right arm going up. The more you try to hold it down, the more rapidly it rises. Feel the tug. Give yourself permission to follow your imagination. Left arm getting more and more tired. Down, down, down. Just let it go. Right wrist lighter. Up, up, up. Now please open your eyes and observe your arms. Notice that even when you attempted to hold them back, your arms responded by rising and lowering even more. Your body reacted to your imagination. That's good. So what did you think about that?
I just think it's, I think it's really helpful that I've done those things before. Like, I mean, I remember being a kid and tying balloons around my hand, and I've definitely carried heavy objects. So having my brain like have those experiences already made it so easy to imagine. But I was amazed at how, like, even at the same time, I felt them doing different things. Like when I had my fingers curled around, it felt like there was a pail or a bucket.
Right.
Really cool.
Yeah. Yeah. All right. Let's go to what slide do you have next?
The next one, well, let's see. We passed the ANS.
Right. Okay. Let's go to, do you have the uterus one?
Yes.
Okay. Let's go there first, and then we'll talk about this. Okay. So you kind of touched on this before, but the uterus is amazing. And, you know, we see TV shows and movies where they portray women holding their breath and pushing really hard and screaming. And they just have a really interesting view of childbirth. And while I'm sure it can be like that for some people, when you're part of hypnobirthing, it couldn't be further from the truth with how you deliver your baby. Your body is designed to give birth. And as you can see from the diagram, the uterus consists of 3 layers. The outer layer is long muscle fibers that assist in bringing the baby down. The middle layers are interwoven with blood vessels, and this is the layer that gets depleted of oxygen if you hold your breath to push. The inner layer consists of circular muscles that are mostly at the lower part of the uterus, and these squeeze to help the baby make his or her final push out into the world. So in so many respects, pushing isn't even necessarily required because our bodies already have a natural expulsion reflex. And this is another example of that. So let's go back to the fear and tension, the ANS slides there. Because as Angie mentioned about fear and tension, in hypnobirthing, we talk about this too. The effect of fear upon labor is not subtle, insidious, or complex. The negative physical effect of fear on labor can be traced to the function of the body's autonomic nervous system, which is the communication network within our bodies. Its main function is to interpret the messages it receives and determine what actions should be taken as a result of the message. It then immediately communicates that directive to the other body systems. These responses are not subject to our conscious control and are therefore involuntary, like that example I gave earlier about seeing a police car. When we are fearful, our bodies tense up, and so does our uterus. Being in this state causes oxygen to be redirected to areas that the body uses for defense. The uterus is not one of those areas. So it makes it so that it receives less oxygen. And as you saw from the diagram, uterine muscles very much need oxygen during labor. If they get deprived of it, you stay in fear mode too long, oxygen to the uterus is limited, so is oxygen to the baby. The cervix tightens as a result, which creates pain, and pain leads to tension, and all of that can lengthen labor. This can also lead to a lowered heart rate and possible distress on the part of the mother or the baby, which then can also potentially mean interventions or a surgical birth. On the other hand, if by being relaxed, you release the happy hormones called endorphins that Angie talked about, and that through different kinds of relaxation and visualizations, you can release that way as well. And you restrict the unhappy ones, those catecholamines. Mother and baby are more comfortable, and there's no assault on either of their bodies. The heart rate doesn't decrease, and the need for medication is often eliminated. First and second stages of labor are shorter and easier, and if a surgical birth ends up being required, recovery from it is easier than it would have been. So hypnobirthing is a wonderful way to help you stay relaxed during your labor.
That's super cool. I love those little experiments with the mind-body connection. It's amazing. Cool. Well, yeah, I think that was a lot of information about how to cope with labor. Yeah, and if you're pregnant, you're surely going to keep on hearing more and more information from people or other resources as the weeks and months go on. But during labor itself, you're going to want to tap into your mammalian brain, not your thinking brain. So during those last few hours before your baby arrives, you don't want to feel overwhelmed with all this information that you've collected. So one thing that birth doulas help parents with is creating birth plans. I know some people don't call them plans since birth isn't designed to go exactly to plan, and it never really does. So you can choose to call them birth preferences, intentions, desired outcomes, whatever you'd like. But a doula spends time with you well before labor to determine what your ideal birth would look like, and share extra research or resources so that you can help make informed choices when it comes to that big day. So a birth plan will help you know all of your options in advance when it comes to labor and early newborn care. It's written out so that your healthcare providers can easily reference it, and you and your partner can easily reference it while you're in labor land and don't want to switch to that thinking brain because you're focused on one important thing already. There's so much to consider when you're coming up with a birth plan, and a lot of things you may not have even considered before. Like you can choose whether or not you'd be okay with medical students being in your room if you're at the hospital. You can decide whether you'd like delayed cord clamping when your baby's born, or whether you'd like to wait to weigh the baby until after you've held them for a couple of hours. So I mean, even just the environment, say you're at the hospital, you can see if you can have the lights dimmed down and wear your own gown. So you have so many options, and birth plans are really helpful for organizing your preferences and remembering them. And like I said, a doula is pretty beneficial to help you write those birth plans. And I think, Andrea, you have some, you can talk about brains and anything else you want us to, want people to know what a doula does.
Sure. Yes, and part of what a doula does, especially if you're in a hospital and you do have a birth plan, is a doula will help remind you of those preferences, especially when interactions are being recommended. We have an acronym that we like to use called BRAINS. And you have that slide, Angie? Yep. Okay. And one of the great things about this is that just because something is recommended to you, and sometimes they might even try to say it's hospital policy, you always have the right to ask questions. After all, it is your body and your baby and your delivery. So we always encourage people to remember this acronym, BRAINS. B as in for the benefit. What is the benefit of this, what you are suggesting? What are the risks of it? Are there alternatives? Also trusting your intuition. Asking the question, what if we do nothing? What would happen there? And then asking for the space to make the decision, because there's nothing more annoying than anybody just kind of being in your face, wanting you to make a decision. But it's even more so when you're pregnant or you're in labor and they want a decision right now. In most cases, a decision does not have to be made immediately. Even oftentimes in the case of a C-section, it does not have to necessarily happen immediately. Sometimes a change of position could potentially remedy a situation. So always, always ask questions, and remember that part of what your doula is there for is to help you remember that you wanted to ask those questions. Because like she was talking about mammalian brain, it is very easy when you are in labor to be very suggestible and to just go along with whatever they tell you. But that doesn't always mean it's in your best interest. So as doulas, our job is to help you remember what you want and to be looking out for your best interests. Ultimately, it's still in your court what decision you decide to make, and we're there to support you, regardless of what that is.
Awesome. So today we gave a brief introduction into some physical and emotional or mental coping and comfort techniques to use during childbirth. And as a thank you for watching us talk about all of this, we'd each like to offer a gift if you'd like to work with either or both of us in any way. Again, we both offer a handful of services, and we have some overlap and some specialties. So if you want to learn more about either of us or need any type of doula support, you can, oh, well, I guess here are the gifts. Do you want to share your gifts, Andrea?
Yes. So I didn't mention everything that I do at the beginning, and I should have. So I am a birth doula, a postpartum doula, and also a breastfeeding counselor. And I hold hypnobirthing classes. So that's where some of that overlap is, but in terms of the doula services. But as a special gift, I would, for tuning in today, be offering $25 off of a hypnobirthing course with me. And I can offer those courses virtually right now as well.
It's comfort of your own home. That's pretty important. Yeah, and then as a thank you for watching our whole presentation, typically if you get my birth support services, it comes with one postpartum visit, unless you want to also work with a postpartum doula. But for watching this, you can get a second postpartum visit after birth support. So you can reach out to either of us. If you squint on this slide, you can see all of our, we have our websites, emails, Facebook, and Instagram. You can reach out to either of us on any of those. Take a screenshot if you'd like to save this, or send it to anyone who needs help. Again, here's our phone numbers. I think this is the only place on this slideshow that has our phone numbers, so you can snag those there too. But I think both of us are happy to take any questions by email. We do consultations if you're interested in talking more.
Yeah, and I don't know about you, but I'm always happy to meet people to find out, for like a free consultation if we're a good fit and I can help them or meet their needs. So. Yeah.
Absolutely. I think one of the most important, if you're shopping for a doula, or even if you're just a little bit interested, I think one of the most important things to remember is that you want to find somebody that you just seem to click with, you feel comfortable with them, and it might come down to a personality thing. So if you find someone who just really meshes with you, that's a great sign for finding a doula that works specifically for you. So, yeah. All right. Well, maybe keep an eye out on both of our websites or social media for more free resources, but feel free to share this along with anyone who's pregnant or planning to be pregnant, or is the partner of somebody who's going to give birth, because this can help them all.
Absolutely.
All right.